Hello, my name's Dr Rod Harvey. I'm the Director of Examinations for the Royal College of Physicians of Edinburgh. In this short presentation, I'm going to take you through the changes which are coming up in the MRCP PACES examination later this year. The new examination is known as PACES 2020. The presentation is aimed mainly at examiners, but will also be of significant interest to potential candidates. This shows the format of the current PACES carousel, which will be very familiar to most of you. There are 5 stations. The carousel lasts 125 minutes to complete, with 5-minute intervals between each station. Essentially, there are 2 clinical examination stations in stations 1 and 3, communication stations in the form of history taking and communication skills in stations 2 and 4, and the combined brief clinical consultation in station 5, which is performed twice. I think the most important thing to recognise is that the changes that have come up in PACES 2020 are evolutionary and not revolutionary. The new carousel looks remarkably like the old. There are still 5 stations. The carousel still takes 125 minutes to complete, with 5-minute gaps in between each station. There are still 10 examiners testing 7 skills, and the examiners work in pairs, marking independently to the same marking scheme. What hasn't changed is Station 3, Cardiovascular and Neurology, which remains exactly as in the present exam. Turning to new Stations 2 and Station 5, these are clinical consultation stations in which the candidate will have 15 minutes to interact with a patient, to take a history, perform a focus examination, address the patient's concerns, and form a management plan, very much in the same way as the current brief clinical consultations, but with more time available. There will also be 5 minutes for the examiner to interact with the candidate, in contrast to the current 2 minutes in the brief clinical consultations. And so for both the examiners and the candidates, these new stations will feel much less rushed. Turning to the new stations 1 and 4, the key changes here are that they contain a new communication encounter which lasts 10 minutes. These are very similar to the communication and skills encounters in the current Station 4, the main difference being that they will last just 10 minutes rather than 14 minutes with the surrogate, and that there will be no interaction between the examiner and the candidates. That means that all skills tested will be tested by observation only, and that is particularly important for skill E clinical judgment, as there will be no opportunity for the candidate to demonstrate to the examiner apart from with the patient themselves. The second part of Stations 1 and 4 are essentially a separated current Station 1, in that there will be a traditional physical examination of the respiratory system in Station 1 and the abdominal system in Station 4. So turning to these changes in a little more detail, what is being removed? Station 2, the current history taking, will disappear altogether. That was always considered to be slightly artificial, with the candidate being asked to take a history in isolation and form a differential diagnosis and management plan without the opportunity of performing a physical examination, which is certainly not representative of an actual clinical practice. So in the PACES 2020, history-taking skills will be tested entirely within the new clinical consultations in Stations 2 and 5. The current Station 4, which is communication ethics, will also disappear, although will reappear within the communication encounters. The 20-minute station was considered rather long. Certainly 14 minutes interaction with the surrogate was often longer than required, and probably longer than would be available in real-life practice. And generally speaking, the interaction with the examiners was felt to add little to the assessment. And that's the reason that this station has been reconfigured into the shorter communication encounters, which will occur twice. The old Station 5 is being removed in its current form, although is being replaced by the new Station 5 and Station 2. The testing of all 7 skills in an integrated manner actually has been considered to be very successful, but the key problem with Station 5 is the time pressure of trying to achieve that all in the space of 8 minutes, with 2 minutes for interaction with the examiner, and then to repeat that once over again. And so it was felt that we needed to actually put in some more time for this form of testing. So the new clinical consultations, these are the key changes. Stations 2 and 5 will have 2 15-minute clinical consultations testing all 7 skills. That will be followed by a 5-minute interaction with the examiner for the assessment of primarily skill B, the physical signs, and skill D, the differential diagnosis, but there will also be more time for exploring skill E, clinical judgment. The other skills will generally be marked by observation of the candidate interaction with the patient. So this is really very analogous to the current brief clinical consultation, although there will be expectation of a slightly more comprehensive history, but otherwise it could be regarded as similar to a brief clinical consultation, but with more time available. The station tests all 7 skills, and the total marks available per station is 28. The communication encounters at station 1 and 4, these will last 10 minutes and are designed to test ethical principles, communication and negotiation skills. Really, these are very similar to the current station 4 and test the same 4 skills. Importantly, there is no direct examiner-candidate interaction, and skill E will be judged by observation only. The communication encounters will be followed immediately by a 10-minute conventional clinical examination assessment of either the respiratory system in station 1 or the abdomen in station 4. All 7 skills are tested in these stations, E and G twice, and the total marks available per station are 36. Station 3 has not changed at all. This continues to comprise 2 10-minute clinical examination encounters for the cardiovascular system and neurology, with 6 minutes for the examination and 4 minutes for the examiner interaction. 5 skills are tested. The total number of marks per station is 40. Again, the method of assessment has not changed. All 7 clinical skills are still assessed and the skills have not changed. There are different numbers and combination of skills assessed at different encounters. There is still a 3-point marking scale, satisfactory, borderline, unsatisfactory, and examiners are not required to make any overall judgment of candidate performance. This graph shows the distribution of skills and marks by station and examiner in the current PACES exam. And what I'd like to draw to your attention is that there is significant variation between the stations and indeed the examiners. So, for example, station 5 carries a total of potentially 56 marks, which represents 33% of the total available, whereas in current station 4, there are only 16 marks available. If you compare that to the new PACES 2020 shown on this slide, you can see that the distribution, although not entirely equitable across the stations, is far more even. So that means that the examiners themselves carry a more equitable burden of the marks, and also the number of marks available per station is more even. So the maximum number of marks available is in station 3, where 40 marks are available, and now the minimum number at a station is in station 2 and 5, which is 28. All of the stations test all 7 skills, apart from station 3, which tests 5. And this should make the exam intrinsically more reliable. And finally, moving to the pass marks. We don't know what the new pass mark will be in PACES 2020, as that will have to be set by a statistical method known as the Hofsey method, which uses the actual marks generated by the candidates to ensure that the exam is calibrated to the same standard as the current exam. What we do know is that the total number of marks available is slightly less in PACES 2020 than the current exam, there being 2 less judgments, resulting in the total marks available being 168 compared to 172 in the current PACES. Given the change in the maximum marks available, it is almost certain that the current overall pass mark threshold of 130 will be reduced somewhat, and that there will also be a reduction in the pass threshold for skill D. It is possible that there may be some other minor adjustments to the pass thresholds for the other skills, but that will only be known after the first 2 or 3 diets of PACES 2020 have been complete. Thank you for listening.